The support and care is really important. It's a big decision for them to come into detox initially, to face the addictions that they have, with drink, substance misuse. So getting them here is a big step for them.
The staff at Chapman Barker genuinely come across like they actually care for you. It's not just that you're a patient or a case number or a file. You are treated as an actual person with feelings, and the person that got me through definitely was Shelley McNally, who was a nurse on the unit. She got me through some very dark times. Christmas in particular, even though it's Christmas Day and the staff are working, they don't see it as just a job. They come in with fairy wings on, and they were all happy, and they made Christmas and New Year the best that they could for us, even though we were in a difficult situation and painful at times, detoxing. Shelley actually stopped me from walking out a few times. On particular, I remember Christmas Day. She stopped me from walking from the unit just by being there and talking to me as an actual person and not like a case study or anything. She actually cared for me, and it was actually really difficult to leave the unit because of that, because it was the first place ever. I've been in the system a long time through mental health issues, and it was the first place ever that I felt genuinely loved, cared for, valued, and it was very difficult for me to break that, and that's why I think I still go back and give back to the community now and do talks for schools. Because of what they did for me, I wouldn't be sat here today.
Whilst having mental illness is never going to be a particularly pleasant thing for most people, hopefully we can make their journey back to positive health a very positive experience. We have a young man called Tam who myself and the team have known for quite a few years now. When we first met him, he wasn't in a good place, he was unwell, he was quite suspicious of us, but over the years we've worked very closely with him, we've supported him, and he has done amazingly well. He's gone from where he was a few years ago. Now he's not under services, he's volunteering, and he's about to become employed actually here at Trafford Hospital, and I think that's down to his spirit and his desire to succeed.
When I was diagnosed with bipolar and psychosis, I didn't know the illness then. The care and service that I had from the hospital, they were very good, and they are very understanding. They understand my illness very well, and they gave me time to not rush into going back to work, but give me time to get better. Dr. Cherry Lewin and her East team, who helped me and support me for the last 6-7 years now, and they've believed in me that I'm getting better, and where they recommend me to volunteer here.
On a day-to-day basis, we cater for halals, Caribbeans, kosher. We can cater for soft diets. We've got a vegan in. Well, we always cater for vegetarians, but obviously a vegan goes that little bit further, so we have to check everything that we have to make sure that it is suitable for them. We can do a gluten-free diet, a low-fat diet, basically any of the requirements that the clients actually need. Birthday parties, where we do a buffet-style tea for them, and that goes in place of the normal meal with a birthday cake, so that they can have basically a party on the ward like you would at home, and that's what we do, try and keep it as in, this is their home while they're here. We will try our best to do whatever we can.
But also the clients do use the dining room as well, and they've got the voucher system, so it's like, they're not confined to using the wards all the time. They can have an access of coming and using our facilities. It's a job that you're not looking at the clock ready to go home, you're into doing your work properly.
But that's the thing people can't get over, that we actually have a 7-day operation, yeah, so it's like, we have to do a 7-day shift system, so there's always somebody here.
I think the catering team listen to what we like, and they put it on the menu. And on this menu, I like the pictures. It's easy to pick. your choice in what you want and what you like. I think the food in here is very nice because they take time in cooking it for all the patients. I've no what's it fault with any of it. It's brilliant.
We feel that it's very important at the JDU and our priority is communication.
The JDU is important to Gina. Why? Because I've been poorly. So who helps? Different people help. The first one, the staff, the nurses, the support workers help. So other things that help you here. So you do what? I learn art. Art helps. Cooking and recovery. Recovery helps. And I like bingo. Bingo helps.
Well, specifically part of the detox will involve some medical care. They'll receive amongst the best medical care in the country here for their needs around drug and alcohol detox, and then they will also have a range of psychological inputs through to one-to-one CBT. I think value and respect is extremely important. One example always springs to mind, a guy called Pete, who is now working for the organisation, and he was always showed great potential when he started as a volunteer. He always took his recovery very seriously, and he just needed some support, really.
I did the detox here. I was here for 3 weeks. I started engaging in the groups and one thing and another, and then I left. And for extra support, the care I received here was fantastic. I've gone through a few detoxes, and by far it was the easiest process. I was really made to feel, as comfortable as possible for a detox. But yeah, then I left, and I was coming back to the support groups on a Saturday, which I found really beneficial. It was just changing my routine and one thing and another, something I encourage service users to do now. And it was amazing. And then they turned around to me and said, "Do you want to come back and volunteer?" And at first I said, "Well, I'll come and do the garden." I come from a building trade background, and that was my initial thing. But then when I got here, the therapy team, Dan Bennett, all the team really, I got that sense of empowerment. They gave me that belief that I could do other things. Dan in particular helped me to set up an email account. They gently pushed me towards delivering groups and things like that, and it gave me that empowerment. He realised that I had something to give. I mean, he helped me with applying for jobs because it was like learning a new language to me. It's a completely different background to what I was used to. Some of the basic stuff that I'd lost touch with through my addiction, really. So in a way, this place helped me to reinvent myself, and I'm doing something that I'm passionate about now. I love it, and I'm giving back what's been given to me. That's it, and I'm still sober. Yeah. You can cut that bit out if you want.